Come in.
Hello, my name is Taylor. I'll be your student nurse today.
Hi.
Can you verify your name and date of birth, please?
Yes, Billy Bob, July 23rd, 1997.
Okay, great. I'm just gonna verify that. And it looks like the physician would like for us to do an assessment. Is that okay if I ask you some questions and it will require me to touch you? Is that okay?
Yeah, no problem.
Okay, great. Thank you. Do you have any allergies at all?
Yeah, I do have like seasonal allergies, like to seafood, cats, stuff like that.
Okay. All right. So first we're gonna assess your eyes. Can you do your eyes first? Can you look straight ahead?
Oh, sorry.
Okay. Do you wear glasses at home? Do you wear glasses at all?
No.
Okay. Any blurry vision or anything like that?
No.
Okay. All right. I'm gonna check your ears now.
Okay.
All right. Both ears are clear. No obvious sign of drainage or anything like that. Now we're gonna check your nares, which is your nose.
Okay.
All right, and we're gonna check to see how open they are, which is the patency of your nostrils. So I'm gonna have you hold one side, breathe in. Same for the others. All right, how does that feel? Do you feel clear? Is it easy to do that?
A little congested.
A little congested. Okay. Have you been sneezing?
Not really, just my allergies.
Is it allergies?
Yeah.
Okay. All right. Next, I'm gonna have you. I forgot this. Can you open your mouth for me? Stick your tongue out. Yeah. Okay. Great. Yeah, that's good. And then we're gonna check your neck. I'm checking for JVD. I will have my patient in a 45-degree angle, and I will not see any obvious signs of JVD. Do you have any difficulty swallowing at all?
No.
Okay, great. And then I'm gonna ask you a few neurological questions. Can you tell me where you are right now?
Yeah, I'm at the hospital.
Okay, and do you know what year it is?
2025.
Okay, and can you tell me your name again?
Billy Bob.
Okay, patient is alert and oriented ×4. And now we're going to go over, we're going to do a respiratory assessment, which is just me listening to your lungs and asking you a few questions about your respiratory system. I'm going to start with listening to your lungs first. Take a deep breath. Hello. Okay. No adventitious lung sounds in all lobes, so everything was normal. That sounded fine. Have you had a cough recently?
No.
Okay. And so if you were bedbound, I would have you do a cough and deep breathe, which would be just turning to your side, take a deep breath in and cough out. And since you're not, though, I have an incentive spirometer for you, which is going to be... Incentive spirometer, which is you'll take a deep breath in. Oh, no, this one you blow out. And we would like for you to use this 10 times an hour. So typically every commercial break, do that. And that just helps expel the expirate the mucus from your lungs. Okay. Do you have any trouble breathing?
No.
Okay. Alright, so now we're going to do a cardiac assessment, which we've already stated there's no JVD noted. And I'm going to check all of your pulses. So I'm gonna start with your posterior.
Oh, yeah.
Okay. Alright, and then next I will check for the posterior tibial on both sides.
Once I showed y'all that my son's short hair isn't actually. I have to sleep right here because if I sleep anywhere,
And then
I'll
we'll check
literally be
about
up
ear
all night
rate.
like nightmares. So you can probably sleep like right on the floor next to me. You have a sleeping bag, right? No, I forgot it.
Okay, so radial, dorsalis pedis, and posterior tibial pulses are all a +2, normal, equal, bilateral. We'll check your capillary refill.
I mean, do you have like a real pillow? I guess. Hold on. I feel like you could probably just like get this and it'll be like a little bed. No. So you should be good.
Okay, capillary refill is under 3 seconds, which is good. And I'm gonna check for edema in all of your legs and your arms.
Whatever. Can I just have some water? Alright, hold on. This is the only water bottle we have left. It's clean, so I mean you should be good.
Okay, no edema found in all 4 extremities. And I'm going to listen to your heart.
Let me lay back.
Hmm?
Let me lay back. Sit back a little.
Okay. I have checked the pulmonic valve, aortic valve, your Erb's point, your tricuspid, and your mitral valve. It sounds strong. If I needed to assess for murmurs, I would use the bell of my stethoscope. And now we're just gonna do a GI assessment, which I'm going to feel on your belly. That's okay.
Wow, that is horrible. What's horrible? You're horrible. Your child eat chicken.
Okay, I would correct myself because I'm supposed to look,
Because that chicken
then listen, and then feel. So
are monsters.
forget I did that. So I'm just starting over. So I would look at my patient, and I'm not going to expose them, but belly, there's no obvious distension or swelling or obvious signs of trauma. So I'm going to listen in the right lower quadrant first. Okay, and after I've done that, I'm just going to feel. Any issues with going to the, like having a bowel movement or anything like that? Okay. Passing gas, okay?
Yeah.
Okay. And I would, if I needed to hear for Brewitt, I would use my bell. And lastly, have you been experiencing any vomiting, nausea, diarrhea, anything like that? Okay. And we're going to do a musculoskeletal assessment, which we're going to check your forearms. So if you do me a favor, stick your arms out, like this, straight out. And then down. Take your fingers and now we're going to assess your fingers. So if you do me a favor, you can relax them now. Or you can do it both hands, it doesn't matter. Flex your fingers. Okay, and then now we're gonna do your legs. Point up toward the sky. Push down like a gas pedal. Point up to the sky. Gas pedal. I'm gonna do the same thing with your arms. So stick your arms out for me. Push up towards me. Push down towards me. Okay. And are you having any trouble walking or anything like that? Any recent falls? Okay. And lastly, have you had any difficulty urinating or anything?
No.
Okay, great. So I'm gonna put all my findings inside your chart and let your physician know, and I'll come back in to check on you. The call light is in reach. If you need anything, just let me know.
Thank you.
Thank you.